Hi everyone, thank you for joining us today for Survivorship Tools and Resources. My name is Ann Willis and I'm Director of the Center for the Advancement of Cancer Survivorship Navigation and Policy and Director of our Division of Cancer Survivorship here at the George Washington University Cancer Institute. Before we get started, I wanted to take a few minutes to go over some housekeeping remarks. We ask that everyone keep your phones on mute to avoid any background noise and disruption during the program. And today's presentation is being recorded. We'll use the Q&A feature for this webinar, so you'll see the Q&A box at the bottom right hand of your screen. So if at any time during the presentation you have a question, go ahead and type it into the box, and we will address it during the Q&A portion at the end of the webinar. And the questions are anonymous, and I will repeat the question. And so while we'll take those questions at the end of the presentation, you can go ahead and write them into the Q&A box at any point during the presentation. And we also have the chat box that's on the upper right side of your screen. So you can use the chat box to interact with each other if you want, but because we'll be talking during the presentation, we probably won't be able to follow the chat box. So again, if you have a question, use the Q&A feature, and if you want to chat with other folks on the call, you can use the chat box. And as a note before we get started, we will send out a PDF of the slides and a link to the archived webinar to all of the webinar participants. And the recording will also be archived on our website along with our previous webinars. So I wanted to take a moment to review today's agenda. I will provide a brief overview of the Center for the Advancement of Cancer Survivorship Navigation and Policy, and then we will move into the presentation. And after that, we will wrap up the webinar with participant Q&A. And again, you can use the Q&A box on the bottom right-hand side of the screen. So I just wanted to give you a brief overview of our Center for the Advancement of Cancer Survivorship Navigation and Policy. The center, which we call CA-SNAP, was created in 2009 through a generous grant from the Pfizer Global Health Partnerships Program. The mission of the center is to advance cancer survivorship and patient navigation efforts locally and nationally through education and training, policy analysis, outreach, and research. The center offers survivorship and navigation resources that are available online at our website and through a monthly e-newsletter. Additional material is sent out through the CA-SNAP listserv to over 2,200 subscribers. We write white papers, create case studies, and work cooperatively with other healthcare organizations to advance patient-centered care. And we also share summaries of meetings and roundtables we've hosted to catalyze patient navigation, cancer survivorship, and other patient-centered care initiatives. And through CA-SNAP, we've offered several trainings, and we were recently awarded funding from the Centers for Disease Control and Prevention that will help us translate our existing in-person trainings into an online format and make them available at no charge for participants. So we'll start with our executive training on navigation and survivorship, which is a nuts and bolts training for building and sustaining navigation and survivorship programs. And then after that one, we will be launching a competency-based patient navigator training. And both of these will be available at no cost to participants through our online academy. Today's webinar is part of the CA-SNAP monthly webinar series that we launched about a year ago. We feature a variety of topics related to navigation and survivorship based on feedback from healthcare professionals across the country. And then we also have several research initiatives that we provide updates on through CA-SNAP. And you can find archived webinars on the results of these on our website along with any reports that may accompany them. And our goal really is to share the findings so we can provide you with information to help you provide patient-centered care. And if there are any topics that you would like to know more about, we would be happy to look into them and do a webinar. So you can email us at casnp@gwu.edu. And here's some more information about CA-SNAP resources. You can visit our website to see webinars and reports. We also encourage you to check out our free Cancer Survivorship e-learning series for primary care providers, and we'll talk a little bit more about that today. And then our next webinar will take place on May 14th from noon to 1 p.m. Eastern Time, and it will cover survivorship education classes and programs. And then again, following this webinar, you will receive an email with a recording, an evaluation survey, and a PDF of today's slides. So here are your speakers today. Again, I'm Ann Willis. I'm Director of CA-SNAP and Director of the Division of Cancer Survivorship here at the George Washington University Cancer Institute. Also presenting is Liz Hatcher, who is a nurse, and she's the project manager for cancer survivorship here at the Cancer Institute. And just as a reminder for people who might have come in late, if you want to chat with each other, you can use the chat box, which is on the upper right side of the screen. And if you want to ask a question for the Q&A period, you can use the Q&A box on the bottom right, and you can ask a question at any point in the presentation. But because of the number of participants on the call, we may not be able to follow the chat during the presentation. We'll go through each of these topics in today's presentation. Some of the things we're working on here that will have relevant findings that you can use. We'll talk about survivorship care plans, assessment tools, reimbursement issues, developing care algorithms, education programs for survivors and providers, and survivor resources. So we'll start with some of our research. We'll talk about a homegrown survivorship care plan analysis that we're working on, a couple of the national surveys that we've done, and our Evaluating Cancer Survivorship Models of Care study. So Liz will talk in more detail about survivorship care plans in a minute, but I wanted to briefly mention a small study that we're working on here. A lot of people use homegrown survivorship care plans. So these are just templates that people create themselves rather than using a pre-existing template that might already exist. And so the goals of this study are to look quantitatively and qualitatively at some of the commonalities and differences across these homegrown care plans. And in the qualitative analysis, we'll be looking at how these templates are developed, but we'll also be looking at how they're delivered to patients and others, including other providers. So Liz will talk about a few existing studies on care plans, several of which focused on NCI-designated cancer centers, but the focus of our small study will be more on community cancer centers. And then we also want to look at how the fields people use in their templates align with the Institute of Medicine recommendations, which Liz will talk about in just a minute. So we've done several national surveys recently. Last year we conducted the Best Practices in Navigation and Survivorship survey to look at things like patient navigation caseload, measures tracked, tracking tools, clinical tools, funding challenges, and recommendations for financial sustainability. So later on in the presentation, we'll be presenting some of the findings. And then also on our website, you can listen to a webinar that we did last year where we reviewed the findings. And then the second study we conducted more recently is the Best Practices for Cancer Survivor Education Programming Survey. And the goal of this survey is to look at any best practices that healthcare professionals identify related to survivor education programs, as well as survivors' preferences for content and how they want to participate in these programs. And our next CA-SNAP webinar in May will provide the results of that survey. And we're really excited about our Patient-Centered Outcomes Research Institute-funded project titled Evaluating Cancer Survivorship Care Models. The goal of this project is to compare the effectiveness of cancer survivorship care delivery models on patient-centered outcomes to ultimately inform a survivorship standard of care. And we believe a highly collaborative approach is really important to making sure the project provides useful information to a variety of stakeholders. So we're working closely with the American Cancer Society, the cancer support community, the Commission on Cancer, which accredits cancer programs and sets standards of care, and Livestrong. And here are some of the project activities and outcomes. Our focus is on survivors of breast, prostate, and colorectal cancers, which are prevalent cancers that also tend to have high survival rates. And so far for the project, we've completed a secondary data analysis of key survivor needs and gaps based on surveys from the American Cancer Society, Livestrong, and the cancer support community. We are almost done with focus groups with breast, prostate, and colorectal cancer survivors. And based on the focus groups, we are creating a patient-centered framework for quality survivorship care. So we will soon start creating a national survey of cancer survivors to validate the framework for quality care. And then simultaneous to those other activities, we've been working on an environmental scan of Commission on Cancer accredited programs to see what kind of survivorship care they're providing, who's providing it, and how the care is being provided. So from this, we'll know the services that are available through these programs, and we will also be creating some more descriptive models of care. And then This summer, we are actually going to begin the comparative effectiveness phase of the project, where we will compare several models in terms of their impact on outcomes, and those are the outcomes that patients identified as important during the first phase of the project. So I could talk about that project forever, but I'm going to turn it over to Liz to talk about survivorship care plans and some other survivorship tools and resources.
Great, thank you, Anne. I'm going to talk a little bit more in detail about survivorship care plans, what should be included in care plans, and tools and resources for creating them. As Anne mentioned, the IOM has issued recommendations on what should be included in survivorship care plans. And this all came out the report that I'm sure you're familiar with, the Institute of Medicine report on cancer, from cancer patient to cancer survivor, lost in transition. And so this report was the first call for every patient and their primary care provider to receive a treatment summary and plan for follow-up care. And the IOM fact sheet that's pictured here, which you can just find by doing a quick Google search for this document, is a summary of what should be included in each survivorship care plan. And we'll look at some studies that have examined how care plans are matching up with these IOM recommendations. So based on these requirements, there are several options for survivorship care plans, including free templates, EMR resources, and commercial software companies. So in our best practices survey that Anne mentioned, we asked people what they were using for their survivorship care plan. And although there are many different tools available, nearly half of the respondents reported using a homegrown survivorship care plan tool. And this tool that's pictured here is one that we use in our Thriving After Cancer clinic here at GW. And we opted to use a homegrown tool. It is based on the ASCO template and the Journey Forward Survivorship Care Plan Builder, but we used our own templates so that we could modify it to our patient population and preferences. And from what we've heard from others in the field, that's why they're doing that as well. So about the same number of respondents in our best practices survey reported using the Livestrong Care Plan and Journey Forward. The Livestrong Care Plan is a free web-based tool that both survivors and providers can use to generate a summary and information about potential effects of the different treatment exposures. So the treatment summary piece is tailored to the individual, but the effects piece is really just tailored based on treatment without individual circumstances taken into consideration. Journey Forward is a free software that the oncology provider or the patient can use to complete a care plan, and it's customizable to each patient. We've heard of people using these templates together to create a more robust care plan for survivors. We also have used the American Society of Clinical Oncology template. They're in Word and Excel, and they were used by 12% of respondents in our best practices survey. EMRs are also a great option for building treatment summaries, but there are challenges with that. From what we've heard, we know that Epic is one company that's looking to build a EMR-based care plan, and there also are commercial tools available, and those might include navigation software systems such as NurseNav that have survivorship care plan templates. So where is the information for these plans coming from? Let's take a look at some guidelines available for survivorship care. The NCCN survivorship guidelines are directed towards oncology and primary care providers, and they really are promoting care coordination. And they're saying that the care of the cancer survivors should include prevention of new and recurrent cancers and other late effects, surveillance for cancer spread, recurrence, or second cancers, assessment of psychosocial and physical effects, and intervention for consequences of cancer and treatment, and then coordination of care between primary care and specialists to ensure that all of the survivors' health needs are met. So they provide algorithms for addressing survivor concerns, And these are included in specific survivorship guidelines and then also in their disease-specific guidelines. So it starts with general survivorship principles, then goes into late and long-term psychosocial and physical problems, and addresses preventative health. And you can, if you go to the NCCN website that's on this slide, you can log in. Anybody can create a login and access these survivorship guidelines. And they're pretty user-friendly. You can go through and click to get through the different assessment and treatment recommendations. For each topic, which the topics can include fatigue, pain, cognitive function, and other specific late and long-term effects, or by disease site. And for each topic, they discuss screening, diagnosis, evaluation, management, and treatment interventions. So ASCO recently came out with some survivorship guidelines, and these were just released on Monday, April 14th, in the Journal of Clinical Oncology. So it's pretty exciting to see these coming out, and as I'm sure you've seen with survivorship, there's more and more being published and coming out, all the time. So it's really important to stay on top of the latest research and recommendations. So for anxiety and depression, they recommended intervals for screening, particularly for screening distress at diagnosis and at appropriate intervals, including post-treatment. And they did give some recommended measures that they included. They gave a whole range of tools and measures, but they particularly focused on the PHQ-2 and 9 and the GAD-7. So the PHQ is the Patient Health Questionnaire. You can either do a 2-question version or the full 9-question version, and that's assessing for depression. And the GAD is general anxiety disorder. It's a 7-question assessment. And so they used both of these assessments in looking at algorithms for assessing and treatment and care options for patients. The other set of guidelines they released were on fatigue. And for these guidelines, they reviewed the Pan-Canadian guidelines and the NCCN guidelines for fatigue. So they recommended that all patients be evaluated for fatigue after completion of treatment and be offered strategies for fatigue management. They did also recommend some tools for fatigue, including screening simply with a 0 to 10 scale, or other specific measures, including the FACT-F and the Brief Fatigue Inventory. And the FACT is the Functional Assessment of Cancer Therapy, and they have a particular fatigue scale. And they looked at some interventions for fatigue and examined the evidence supporting those interventions. And so they have recommendations on physical activity, cognitive behavioral therapy, and mindfulness-based approaches, as well as yoga and some other possible interventions for fatigue. The third recommendations that were issued in this issue of the Journal of Clinical Oncology were for chemotherapy-induced peripheral neuropathy. And they based these recommendations on a review of 48 randomized clinical trials. And they weren't able to recommend any particular agents for prevention of peripheral neuropathy based on the lack of high-quality, consistent evidence. But with regard to treating peripheral neuropathy, they said that the best available data support a moderate recommendation for treatment with Cymbalta. So you can read those. Those are available online as well. And I think it's really exciting that they're coming out with more guidelines. Another set of guidelines that will be coming out will be coming from the American Cancer Society. And these are guidelines for primary care providers caring for breast, prostate, and colorectal cancer survivors. And these guidelines are part of the National Cancer Survivorship Resource Center, which is a collaboration between us at the GW Cancer Institute and the American Cancer Society, which is funded by a cooperative agreement from the Centers for Disease Control and Prevention. And ACS also has nutrition and physical activity guidelines for cancer survivors. And just to review these, they're similar to their guidelines for cancer prevention, but they recommend that survivors achieve and maintain a healthy weight. And if a survivor is overweight or obese, limiting consumption of high-calorie foods and beverages and increasing physical activity to promote weight loss. They recommend all survivors engage in regular physical activity, avoid inactivity, and return to normal daily activities as soon as possible after diagnosis, with an aim of exercising at least 150 minutes per week. They also recommend including strength training exercises 2 days per week. For dietary recommendations, they're recommending a diet high in vegetables, fruits, and whole grains. So we've reviewed the recommendations for what should be included in survivorship care plans, but now we wanted to look at what's happening in the field and some recent studies that we thought were interesting about survivorship care plan usage. So this particular study compared self-reported oncologist provision and primary care provider receipt of treatment summaries and follow-up care plans. And they were looking at the characteristics of oncologists who reported provision of these documents to primary care providers and other associations. So they surveyed over 1,000 oncologists and 1,000 primary care providers. And nearly half of oncologists reported always or almost always providing treatment summaries, but only 20% reported always or almost always providing the treatment summary plus the follow-up plan of care. From the PCP end, approximately 1/3 of PCPs indicated that they almost always or always received treatment summaries, but only 13% reported always or almost always receiving the full survivorship care plan. And oncologists who had training in late and long-term effects of cancer and use of EMRs were more likely to report providing the survivorship care plans. And for primary care providers who received survivorship care plans, they reported feeling more positively about care coordination and having more confidence in survivorship care plan knowledge. Another study evaluated concordance of the treatment summary and survivorship care plan with those IOM recommendations that we discussed. So researchers examined 65 treatment summaries and survivorship care plans from 13 cancer centers, and they rated these against the IOM recommendations, and they also administered surveys to the providers who had created these care plans. So you can see from the results, on average, 46% of the IOM content recommendations were met for the treatment summaries, under 60% for the survivorship care plans. So no sites had more than 75% concordance for the treatment summary, and 2 sites met this for the survivorship care plans. And so when they asked, why were they unable to meet these IOM recommendations, or what were some of the challenges, the time burden for creating these survivorship care plans was noted as a barrier. And for anybody on the call who's created survivorship care plans, that certainly does seem to be true. So the authors called for further research to determine which elements of the treatment summary and survivorship care plans are essential and determine if the outcomes of survivorship care planning warrant the resources required for it. So that was really a call for some additional resource in this field. So we have another study from 2013 that looked at perceived barriers to survivorship care by primary care providers and oncologists. And this was based on a nationwide survey of barriers and was particularly for breast and colorectal cancer survivors beyond 5 years after treatment. So looking at care of these survivors after 5 years. And you may have seen other studies published from this survey. It was the Survey of Physician Attitudes Regarding the Care of Cancer Survivors, which was conducted in 2009. So both oncologists and primary care providers felt that the inability to pay was a barrier to quality survivorship care. Medical oncologists were more likely than primary care providers to report patient language as a barrier, insurance restrictions that would limit tests and treatment, and another barrier that oncologists cited were patients requesting more aggressive testing, that these survivors were requesting more aggressive testing, and this was a barrier to true quality care. Primary care providers were more likely to report inadequate training in survivorship care and felt that they were ordering additional tests and treatments because of malpractice concerns. And oncologists were more likely to report uncertainty regarding general preventative care and responsibility, who's responsible for that care. So this study and others from the SPARCS survey show how PCPs and oncologists perceive survivorship care differently, and how a survivorship care plan can help coordinate care and reduce barriers to quality care. If patients are educated on what testing is necessary, and primary care providers feel they have the information and training to address care needs, care for survivors may be greatly improved. So another research study we wanted to share with you is on looking at consistency of survivorship care plan use. And this study had 36 respondents, and the majority of the respondents indicated that survivorship care plans were used for fewer than half of their survivors in their program. And this is a 2014 study, so this is pretty recent information as programs are starting to provide these survivorship care plans. So looking at these results, only 5 programs, which was 15% surveyed, were developing survivorship care plans for at least 75% of their survivors. 25%, so 8 programs delivering care plans, to 75% of survivors for whom the care plan was developed. So there is a gap. Even when you're developing the care plan, is it being delivered? And then is it being delivered to the survivor and the primary care provider? So 7 programs were consistently delivering the care plans to at least 75% of the primary care providers. And only 1 program had scores above 75% or around there in all areas. So the authors also asked about barriers to consistency and lack of resources, which included time, staff, training, and money. That was the top barrier cited by 80% of the programs surveyed. So a follow-up study by these same authors was looking at the determinants of survivorship care plan use. There were 81 respondents to this study, and again, this recently came out. The survey was conducted between January and May of 2013. And of those surveyed, 56% reported that survivorship care plans were not being used. Of those using the survivorship care plans, primarily they were serving breast or colorectal cancer survivors only within their programs, and only a low percentage of care plans were reaching both the survivors and the primary care providers. And again, the barriers were insufficient resources, perceived difficulty in using survivorship care plans, and lack of advocacy for survivorship care plan use from influential people. And academic programs and NCI community cancer centers were more likely to be consistently using the survivorship care plans. So we just wanted to discuss a conceptual framework for survivorship care plan research that we thought was interesting. You know, as you're looking at these research studies and also thinking about evaluating your own programs, we thought this conceptual framework could be a useful tool in planning research. So this figure was presented by authors from the NCI in ASCO's Journal of Clinical Oncology, and it offers a conceptual framework for research. So on the left of the model, you can see that care plans are shown embedded within models of care, within the process of care, and shows the technology platforms that would ideally support the generation and sharing of survivorship care plans. The individuals involved in the generation and use of survivorship care plans are represented in the middle ring of the circle, and the intertwined circles to the right represent the 2 intermediary constructs through which the IOM postulated that survivorship care planning might affect outcomes. So this is the survivorship care plans will affect outcomes through care coordination and communication. And looking at the outcomes, there are the short-term outcomes and the long-term outcomes. The first column are the short-term outcomes, which include adherence to follow-up care protocols, provider management or self-management of late and long-term effects, comorbid conditions, healthcare resource use, and organizational effects of care planning. The far right includes two potential long-term outcomes, physiologic and psychosocial morbidity, and cost implications. So now we'll talk about some clinical assessment tools and what are people using with these care plans to look at outcomes in their survivorship clinics and survivorship programs. So in our best practices survey, we asked what constructs were being assessed. As you can see, distress, satisfaction, quality of life, and physical activity were the most common constructs being assessed. And so how are these being assessed? What tools are being used? Again, this is data from our best practices survey. And as you can see, the distress thermometer, which is available from NCCN, was one of the most common tools used. Patient satisfaction surveys were up there, homegrown tools, no tools being used, particular fatigue scales, the PHQ-9 and the FACT-G, which this is a more general FACT assessment than the fatigue one we discussed earlier, were also cited as being used frequently. So I wanted to give you some examples of tools. We use kind of a mix of some validated tools and then some homegrown tools in our program. We do use the PHQ-9 to assess for depression. We also developed our own questionnaire to just gather some information about the patient. When were they last seen by their oncologist? Do they have established care with a primary care provider? And ranking their understanding of their survivorship needs and knowledge about late and long-term effects. We also adapted, and again, you know, we always encourage, there's no reason to reinvent the wheel. We found this form that Mayo Clinic had developed, and we contacted their education department and asked if we could adapt it for our survivorship program, and they were very helpful and accommodating and allowed us to do so. So we've used this assessment with their permission. It's about a 3-page assessment, and you might not be able to see the fields in there, but it assesses concerns regarding physical effects, social issues, emotional aspects of care, spiritual issues, and others such as care coordination. And it asks the participant or the patient to rank their concerns on a scale of 0, not a concern at all, to 5, an extreme concern. And we assess patients before they come into the clinic, so we know a little bit about what their needs are going to be, but this form allows the nurse practitioner who's delivering the survivorship care plan to prioritize the patient's needs for that visit. So we found it to be helpful. There are other assessments and tools that are out there. I wanted to give another sample. This is in the NCCN survivorship guidelines, and it just gives a baseline assessment that covers a lot of different fields: anxiety, cognitive function, fatigue, pain, sexual function, sleep disturbances, exercise, and immunizations and infections. So it's another possible tool that you could use to build your assessments for your program. So for choosing your assessment tools, you want to first determine the outcomes of importance and at which points you can assess survivors. We do a lot of baseline measures that really direct the flow of our clinic visit, but what we want to be looking at for the future of our clinic is when should we be assessing to look at how the clinic has affected these outcomes. You know, when should we send post-clinic measurements. So I think that's important to consider to be able to show how your program is affecting your survivors. And there's other information out there in the literature. We gave a few examples. Another example that I wanted to include was a systematic review of quality of life instruments in long-term breast cancer survivors. which showed the adult cancer survivor scale as being a good measure for quality of life in this population. There have been some good reviews of the measures out there. Another great source for finding validated measures is the NCI GEMS Care Planning Initiative. And we have the website here, and we'll show a screenshot of it next as well. But it provides a list of constructs and tools related to survivorship care. And these were validated within the field with survivorship experts, people who have been doing these programs and doing this research for a while. And it also has an opportunity for others to rank these tools and to rate them. So you can look at what people have said about these tools, about their use in research or in practice, and see any comments on them. And they do have links to the actual tool when it's available. And we actually saw this week that NCI is hosting a webinar tomorrow that might be of interest to you on this care planning site, and it's on advancing survivorship care planning through community engagement. So we just wanted to include the information for that on here as well. So as you can see on the GEM Care Planning Initiative webpage, they have the constructs that you can look through, and this I just searched for fatigue measures. And as you can see, the brief fatigue inventory is listed here at the top. We've discussed that, was included in the ASCO guidelines as well. And it shows the average rating, and it has a link to the PDF. So you could download that measure potentially. Sometimes they have links to the studies where the measure might have been described, but oftentimes it's linked directly to the measure.
So now we'll talk a little bit about reimbursement challenges, and this is something that comes up pretty often, so we wanted to bring it up. So again, in our best practices survey, we asked respondents to identify the biggest reimbursement challenges for their survivorship programs. So you can see from the chart, about a third said that the creation of the care plan is the most challenging, which, as Liz mentioned earlier, is really to be expected. Creating the plan can take anywhere from 15 minutes to more than 2 hours, and that time period is true whether or not you have an electronic medical record. So we know that that takes a lot of time and that there aren't currently good reimbursement mechanisms for that. So interestingly, more than a quarter of respondents said that they had no reimbursement challenges. And then other big challenge areas were nutrition services, care plan delivery, care coordination, weight management, psychosocial care, health promotion, psychosocial assessment, and patient navigation. So keep these in mind as we go on to the next slide to talk about reimbursement mechanisms. So the question of how to get reimbursement for survivorship programs, again, it comes up all of the time. There's actually a great article that was in Oncology Issues, and we have the citation on the screen. And it outlines the types of services and the actual codes that can be used in a survivorship program. So we always recommend that if you're doing survivorship, you should talk with someone in your billing department. They're really the people who know about the different codes and know which codes might work given your situation. So I won't go through each one of these because there are a bunch. And you don't need to scramble to write all of these down. We'll send out a PDF of the slides after the call. But you can see on this slide that some of the things that people said on the previous slide were reimbursement challenges, that there are actually potentially some procedure codes that could be used depending on their program. So this slide is similar, but it shows HCPCS codes. And I'm not sure if you're familiar with HCPCS codes, but they're these kind of special codes that not all insurance companies will accept. So again, I would recommend talking with your billing department to see if these are options, and I think they would probably work with the insurance companies to make sure that these will be covered. But again, you can see here that there are many codes that are available for things like weight management, exercise and nutrition, and other things that might be helpful for a survivorship clinic. So another thing that you might want to consider is developing an algorithm or a process of care or guidelines for survivors. So this may be especially important if your primary patient population is one where there are no NCCN or ASCO guidelines established. This is a process that we found for developing an algorithm. So first you would identify the team. So you might have a group of people that includes different clinicians, maybe whoever is heading the survivorship department or program. So you would identify the team. You would create some kind of framework for the algorithm. You would identify your patient population and think about both in terms of disease type, but also if your population has any other special issues or characteristics. Maybe they have large health disparities or access to care issues. Those are things that might influence your algorithm as well. You would then identify end users, so this would likely be other clinicians. You could conduct a literature review and summarize each article, and this part could be done by one person or by a group. And then based on the evidence, you would then draft the guidelines, and again, one person could be responsible for drafting the guidelines, or there could be some subset of a group, or the whole group could do it together. And then you would definitely need some sort of larger discussion to finalize the guidelines, and then after that you can track outcomes. So I put up a screenshot of MD Anderson's website just to show you their survivorship algorithms. So they're posted online for free. Anyone can download them. On the next slide I'll show you one of them. But you can see that they're available across a variety of cancer types and different symptoms as well. So when you click on one of those links from the previous slide, this is what it looks like. And there's actually several pages, but I just put up the first page. And I'm not going to read it to you, but you can just kind of get a sense for how they're visually laid out. And in this case, it's related to breast cancer survivorship and bone health. So after the page where they show the graphic, they also have all of the resources that they cited when they pulled it together. And if you Google MD Anderson survivorship algorithms, you'll be able to find all of these. And again, they're available for you to download so you can see them. So another thing we wanted to talk about is provider education programs. And we mentioned this particular program at the beginning of the call. But one free program that we created is the Cancer Survivorship e-learning series for primary care providers, which we launched a year ago yesterday. So the title does say primary care providers, but we've actually found that providers of all types have been participating in the program, and our feedback on the program indicates that people are of all kinds, whether they're specialists or primary care providers, really find the content helpful. So this program is part of the National Cancer Survivorship Resource Center that Liz mentioned earlier. If you're interested in learning more about that project, we have the link again at the end of the program, but it's cancersurvivorshipcentereducation.org. And again, it's a free continuing education program. We have credits for physicians as well as nurses. And you can also participate in the program even if you don't want the credits. And again, the website is cancersurvivorshipcentereducation.org. And we currently have 5 modules that are available, and the sixth one will launch in the next month. So the first module is the 20,000-foot view of cancer survivorship. The second module covers the physical impacts of treatment and how to manage treatment-related comorbidities. The third module focuses on the psychosocial impacts of treatment. The fourth module discusses prevention and wellness strategies and reviews the American Cancer Society's nutrition and physical activity guidelines that Liz mentioned earlier. The fifth module focuses on care coordination across specialty and primary care providers. And the sixth module will launch in the next month, and it will cover rehabilitation for cancer survivors as well as spirituality. And then over the next year or so, we'll also be launching modules on the survivorship guidelines that are being developed through the National Cancer Survivorship Resource Center, and Liz mentioned those earlier, so we'll start with breast, prostate, and colorectal guidelines. So now I'm going to turn it back over to Liz to talk about Survivor Education Program.
Another important tool in survivorship programs is providing education to survivors, and again, there are some great templates that are out there. One of them is the Cancer Support Community Livestrong developed Cancer Transitions Program, and this is a program, and you can find out more information on the Cancer Support Community's website. It's a 6-week program for educating survivors, and they have presentations and educational handouts that are available. We also developed, and we based this on a template for a program called the New Norm. We developed our own Next Steps to Wellness program, and this is a it's a one-evening information educational program for survivors that I'll talk about in a little bit more detail in the next slide. There also is the Thriving and Surviving program, which is a self-management program. It's in person and is being tested online as well, and this is for helping patients manage the late and long-term effects of their cancer treatment. To just give you more information on Next Steps to Wellness, and if you're curious about the program or would like to see the presentation that's used, feel free to email me, or my contact information will be given at the end of the slide. I'm happy to share it. It's an educational program for survivors. It covers late and long-term effects of cancer and cancer treatments, the diet and physical activity recommendations, emotional coping and psychosocial concerns, and practical concerns such as financial or legal that cancer survivors may still be dealing with. And we, as Anne mentioned, part of our research is to do a survey to determine survivors' preferences for education to help us refine our own class here and share this information with others who are doing cancer survivor education programs, that they can make their programs more patient-centered as well. And we wanted to talk just briefly about some resources for survivors that you may be referring survivors to or looking at yourself for more survivorship information. Anne mentioned the National Cancer Survivorship Resource Center through our partnership with ACS, and there's some great information on that website. Livestrong also has some good information on their care plans and other lifestyle recommendations for cancer survivors. The American Cancer Society's Cancer Survivors Network has great resources for cancer survivors, and also they do patient advocacy, which many survivors may be interested in after treatment ends. Cancercare.org has great resources for both providers. They have really informative webinars, and then also for patients, they have social worker facilitated online and telephone support groups, which are a great resource for busy survivors who may not be able to get to an in-person support group. Some other resources are the Patient Advocate Foundation. Again, if people are still dealing with some of the insurance issues, financial issues, Patient Advocate Foundation works with patients with other kinds of illnesses, chronic diseases, not just cancer, but they're a great resource. Cancer and Careers offers really practical tips for going back to work, what to disclose at work, how to, structure a resume to minimize a gap in employment due to illness. And the Cancer Legal Resource Center, I think their trainings have been really helpful to me as a, provider and navigator for looking at, job accommodations, legal protections for cancer survivors, and they also do consultations for survivors who may be having a legal issue.
Great, so thanks, Liz. So now we have a few minutes for questions and answers. So as a reminder, you can use the Q&A box on the lower right side of your screen to submit a question. And then while we're waiting for a few questions to come in, I wanted to mention again that we will be sending out the archived recording of the webinar along with the slides and a brief evaluation after the call today. So it looks like we have one question that's come in. How many people responded to the best practices survey? That's a great question. So we had a different number for different questions, but on average there were about 50 people who responded to each question. We have another question, and Liz, this one might be good for you. Which survivorship care plan template is the best one to use?
Well, I think they all sort of have pluses and minuses. And, and I think sort of because of that, a lot of people end up going with a homegrown tool. So, for ours, we used some from the Journey Forward because they provided some really great information that we didn't think particularly overwhelming on late and long-term effects and things to look out for. But then the ASCO template's way of just organizing the data and the treatment summary was fit with our needs as well. So, I hate to say it depends, but as of right now, we don't really have information on what's the best. And I think some of the research that Anne talked about with evaluating survivorship care plans, determining which elements are the most essential of the IOM recommendations, that will really help us narrow down, what is the best option in the future.
Great. So it looks like we have another question. Are there any recommendations on care that overlaps with two specialties? So, for example, surgical oncology and medical oncology. So it sounds like the questioner shares the long-term care of the patient, and there's some overlap. So I don't know, Liz, based on your experience in the Thriving After Cancer program, if you have any recommendations about that kind of shared care and coordination across different types of providers.
Yeah, that can definitely be a challenge, especially if providers are at different institutions. I mean, even within the same institution, it can be a challenge. And, on our care plan, our nurse practitioner, she says, that the survivor, she's making a recommendation that they need a clinical breast exam every 6 months. She'll say, we try to say specifically who should be doing this. And, for that one, it can be your medical oncologist or your surgical provider. Just as long as it's getting done. And since this plan is going to each provider, they can sort of, use that as a benchmark to make sure that they're doing it or to make sure that it's getting done by somebody else. But, that can lead to, some duplication of services. So it's having somebody who's helping to coordinate that care. And for long-term survivors, that often becomes the primary care provider, that they're the ones coordinating the care, making sure the patient's still seeing their oncologist if they need more follow-up, and making sure they're getting the tests they need based on the information in the survivorship care plan.
Great. And it looks like somebody else chimed in that in their treatment summary and care plan, they delineate who's responsible for what care, so whether it's the PCP or the oncology providers. So we have another question. How can community-based cancer programs coordinate a survivorship program among independent and hospital-based providers? So this is a great question. I'm not sure that there is a perfect answer to this. I can talk about it. I don't know if Liz, if you had anything that came to mind.
Yeah, I mean, I think, our clinic, we are coordinating care for, multiple providers at different institutions, and it can be a challenge. I mean, just even getting the records to create the survivorship care plan really adds to that sort of resource-intensive aspect of it. But there is, that once the patients finish treatment, they're referred to this clinic, and where that referral comes needs to be, made systematic. So that whether it's coming from the hospital provider or, whatever that point is where they're finishing care, that's where the referral should come into the survivorship care plan, their survivorship program, and that the care plan should help coordinate the care between the providers.
Yeah, I think that's a great answer. And I would just add that I think it's really important to create a process that's documented so that everybody kind of knows who's responsible for what in general. And just being clear who is responsible for, like Liz mentioned, those referrals, but who's actually responsible for delivering that care. And so a lot of, or one particularly successful strategy that we've heard others talk about and we've used here is to create some kind of survivorship task force that includes the main people that would be involved so they can talk through whatever that process would look like so that you can make sure that everybody's on board and that everybody feels like they've bought into it. So we have another question about utilizing the oncology registry for helping to create the survivorship care plan. So that is a great question. The registry is a place that you should definitely look into. One of the issues with registries is that they don't always collect the right data for a survivorship care plan. So currently the standards for cancer registries don't include even collecting, for example, that a patient has finished treatment or the specific doses of the drugs or other treatments that a patient may have received. So I think there are ways to connect with the registry, and I know Journey Forward and I think Livestrong Care Plan are looking at initiatives that help to connect in with the registry to automatically pull that data, but unfortunately you're oftentimes limited by what information your registry collects. So we talk a lot with our registrar here, and she's very helpful. Even if your registry doesn't currently collect the data that you need, that person is important for participating in a task force or whatever group you have of people that's trying to figure out the process, because they really know what data is available and they can help make sure that you have access to whatever it is that they have. Great. So it looks like there's no other questions. I'll give you just a few more seconds if there are any other lingering questions. But thank you all so much for participating in today's webinar. And again, we will send out a link to the archive and archived version of the webinar. And then we also archive every webinar that we do on our website. So if you want to go check out our website, you can access any of our previous webinars and find out about any upcoming webinars that are scheduled as well. So I don't see any more questions. So I just wanted to put this slide up again. So there's a link to our website where you can find our webinars. Here's the link to the Cancer Survivorship e-learning series. So again, our next webinar will be on May 14th at noon Eastern Time, and we'll talk about survivorship education classes based on some of the work that we've been doing. And if you have any topics you would like to suggest or need additional information or resources, feel free to reach out to us at casnp@gwu.edu. Thank you so much.